I'm Dr. J.P. Pizzino, and today I want to let you know that there are certain diets that have been proven to improve outcomes with things like breast cancer. And this is whether you're going through standard treatments like chemotherapy and surgery. They've actually been using these diets around chemotherapy to get better results and reduce the side effects. So this can be very, very helpful. So we're going to talk today about two different kinds of diets. There's one called a fasting mimicking diet, or FMD for short, and another ketogenic diets that you may have also heard about. We have another video on that. And these are giving better outcomes for breast cancer. So this is something that you can do yourself in addition to whatever your oncologist is recommending for you. Fasting mimicking diets, or FMD, are very low calorie diets of a specific composition that are done for very short periods of time, such as just 5 days a month. Sometimes we only do them for 3 days prior to chemotherapy sessions. And when I say they have a specific composition, this is not simply limiting yourself to 5 100-calorie bars a day, because it just doesn't work that way. It actually has to be usually a fairly high-fat form of foods. And so this is actually a prescription of a fasting mimicking diet. And it's a way to eat a little bit and still turn on stem cells and other regenerative healing in your body. So it works not only for cancer, but there are other diseases. It's been shown to improve things like hormonal conditions such as thyroid disease or even some menopausal conditions. Some athletes are using it to improve muscle building and so forth. So these fasting mimicking diets are really a hot topic right now. And it is important to work with a doctor in order to do these to get the best results from that. And of course, anytime we're talking about anything related to cancer, we want to make sure that your oncologist or your cancer doctor is on board with what we are recommending. These are being shown in research studies, and that's why I'm talking to you about it today. But sometimes the oncologists are so busy with everything else, they're not aware of all these options. Ketogenic diets are different from the fasting mimicking diet because they often do have plenty of calories in them, and there's no fasting going on, but it's turning your metabolism from carbohydrate burning into fat burning. And this is actually really beneficial for cancer because most cells actually have two fuel types. They can burn carbs, they can burn fats. But cancer cells, one of the mutations that they have is they've lost the ability to burn fats, and they can only burn carbs. It's one of the reasons why we recommend reducing intake of sugar when you have cancer, because that only feeds cancer cells. And so when we are in a ketosis state, that's the term in a ketogenic diet, then the cancer cells are basically not getting any fuel, and then that causes them to die. So the ketogenic diet is not just an eat this, not that kind of a diet. It's actually chemically changing your metabolism, and it has to be measured and monitored to actually be accurate. There's different ways of doing that with urine, blood, and breath monitoring. Again, we would want to talk about this in our consultation if you decided to use this. And we don't stay on those ketogenic diets for long periods of time. Particularly if you've had a lot of weight loss with the cancer, we might even be very limiting on that because we don't want you to lose too much weight. I do also want to mention to you other types of diets that have been shown to be beneficial with hormonal cancers, such as breast cancer and prostate cancer. And they're actually significantly easier to do than the fasting mimicking diet or the ketogenic diet. And those are plant-based diets. There's good evidence that plant-based foods have many phytonutrients in it. Those are these micronutrients that form all the colors in fruits and vegetables that turn on various kinds of natural healing in our bodies and help to counteract hormonal things like that cause breast cancer and prostate cancer. So those are some nutrition-based information about how you can improve outcomes for cancer. And I'd love to consult with you more if that's something that you're interested in. You can go to our website, selfempoweredhealing.net, and sign up for a free consultation to learn more about how it would apply to your particular condition. And don't forget to send this video to your friends and family and subscribe and check the bell to get more of this kind of information.